I'm Dr. Kenny Levine. Welcome back to Health Talk with Dr. Gregory Albert. Dr. Albert, let's talk about what you do outside the hockey arena. Tell me what are the most common procedures you do. I'm intrigued by what you do for men also. So let's hear the difference between men and women and what special services you provide for them.
Yeah, so as we kind of touched on before, patients are living longer and they're living a more active lifestyle. So I have men and women coming to me. Most of the time, and if they're working for us, they're saying, I want to look younger, I want to look better, I don't want to look as tired, and I want to look as on the game or in the game as I can, so I can have as much the best possibility for my professional life as well as social life.
Right.
And so a lot of times guys come to me and they don't like their neck. And that can start at late 30s, 40s, where they get the little extra neck there. And then the eyes, I would say, is pretty consistent for men and women in about their 40s or 50s.
Right.
And then after the eyes go, it's a facelift and a neck lift.
Now, is there a sequence to this? If somebody has one thing done, does it postpone the next step and the next step? Or are they better off waiting until they need everything done at one time? What do you suggest? Or is
That's
it
a good
an individual
question.
case?
That's a very good question. And the way I approach a patient is I put a mirror in their hand. And instead of patients, everybody asks me, well, what would you do to me? I could do a bunch of different things to you, but the most important thing is that I fix or improve what the patient's bothered by.
Correct.
Because if it doesn't bother them and I fix it, it's still not going to bother them. So, but usually it starts, with fillers and Botox have come a long way.
Right.
So the patient population for that is anywhere from the 30s to 60s, 70s, and in their 80s, because some patients are too old, they don't want to go through surgery,
Right.
or not healthy enough for surgery. No one's really too old for surgery except if they're not healthy enough.
Correct.
So the fillers can get patients, for the nasolabial folds, for the lines in the face, get them back within a couple hours.
Marionette lines and things like that.
It's one of the true lunchtime or really, break type of procedures. And then the Botox is great for lines of expression, makes people look relaxed. It helps with the crow's feet. And in Florida, when we're always squinting in the sun, that's particularly, a good thing.
Sure.
And then as far as surgery goes, it's generally, some patients aren't as concerned with their eyes, but generally it's the upper and lower eyes with the bags that happen and the extra skin,
Mm-hmm.
and then it becomes to the face and the neck.
I've seen some people that have wonderful facelifts, people that I know, and all of a sudden you look at them and it's what you described. They don't look tired, they look more vibrant. And then I've seen some terrible facelifts where they look like they're a snare drum,
Right.
where the face can hardly move. Has that changed over the years with training? If I go to a plastic surgeon and trained and hasn't taken a course in 50 years, is it more likely to be an adverse result than somebody who's up on what's happening?
I think it has changed. With the advent of less invasive type of procedures, I think we are seeing less of those abnormal or funny looking facelifts. But there really are, I also do minimally invasive procedures where I use endoscopes. So in someone who's in their 40s or 50s, a woman who comes into me who doesn't necessarily have a neck that's sagging, but her cheek has fallen,
Mm-hmm.
and she's developed that long face where she just looks drawn. Without any incisions on the face, I can endoscopically lift up her cheeks and her jowls and make her look younger. And a surgery that you can almost not even tell they had done. And that's a good point. More patients are coming in now and they're saying, I want to look refreshed, but I don't want anybody to know I had anything done.
Right.
If you come in and you already look older, well, I'm going to make you look younger and more people might notice it, but still tell patients that my best work goes unnoticed.
No, you mentioned minimally invasive and more conservative. We have the same thing going on in dentistry today. From my surgical aspect, we use a lot of lasers, which is certainly less invasive and less aggressive than we did before. The restorative dentists have bonding and veneer materials where they preserve much more tooth structure, and it's less aggressive than it was before. I guess overall, whatever phase of medicine, dentistry you're doing, it's better for the patient.
Right. As long as you're telling them, you know, they're satisfying what they're looking for.
All right, we're going to be back in a minute. There are a couple more things that are interesting to me personally I want to get into. Dr. Kenny Levine with Health Talk. We'll be back in just a moment. Thank you.